Welcome back and thanks for staying with us. Medical negligence has been discussed several times on this show, but it cannot be overemphasized. Recently, a Nigerian couple shared the heartbreaking story of how their 17-month-old baby girl died at a hospital in Port Harcourt. According to the parents of Loli, she died in February as a result of what they term medical negligence. But the doctors also blame the parents for contributing to the death of their child. Do parents also contribute to the death of their child in Nigerian hospitals? You can join this conversation by calling 07080668014 or tweeting to us at TVC Connect with the hashtag YourView. TVC Connect. But please hashtag YourView TVC so we can read your tweets. Okay, please establish this story for us so that our viewers know what exactly happened.
The hashtag is Justice for Loli. Okay. Loli is a 17-month-old baby, and born to Harry and Toki in Port Harcourt at about 7 a.m. in the morning. They had noticed temperature at night, but they were sponging her and thinking it would go over time. But when it didn't reduce, in the morning, 7 a.m., they went to the hospital on their way to the creche, and then the hospital said that they would admit the baby based on what they noticed. On admission,
they claimed she had malaria.
Treated her for malaria. They said they kept seeing. One thing I want to signpost was that when they got to the hospital at 7 a.m., they said that they had to wait until the morning devotion ended. So they had a patient that was rushed in, but the patient had to wait until the hospital finished their morning devotion. Okay. So after treating for malaria, there was no improvement. They waited for 2 days later.
They started treating her for meningitis.
They now got a specialist, a pediatrician, to come and see the baby. Found out that it was actually meningitis. Then they changed the treatment. By that time, the baby's neck was stiff and could barely move it voluntarily. Yeah. Few days down the line, baby died. And that was her.
No. So they called in another specialist because she wasn't getting better from the treatment for meningitis. The other specialist then said to change the drugs. It was when they changed the drugs that they saw a rapid decline in her health, and then she died.
So they had 3 doctors check her. Yeah. A pediatrician checked that, claimed meningitis, no improvement. The 3rd doctor gave her, and they said that she died. The parents felt that she died of overdose of medication. Finally, the end part of the story is that they tried to get the medical reports from the hospital that, okay, let's see what you actually did. What are the case file? And they couldn't get it.
They denied them.
They denied them, and they actually twisted the story to make it look like, according to, I'm reporting it based on what the parents are saying, that the doctors twisted the story to make it look like they were at fault for what happened to their daughter who died. This isn't new. You mentioned during the introduction that we keep seeing this happen over and over again. Yeah. But the angle on this is that at what point would my take is that at what point would the parents realize that something is going wrong in this hospital? Let me get my child out of this place.
Okay, so let us even take it from the angle of the hospital. Go ahead, Michael.
I just wanted to say the parents had been waiting for that child for 4 years.
Yes.
They've been married for 4 years.
Before they had the baby. Let us take it from the angle of the hospital, saying that this negligence is on the side of the parents. How would you, a parent who noticed that your child had temperature overnight, and the next morning you bring her to the hospital, how can anyone claim that you were negligent? You have done the right thing by bringing her to the hospital. She was on admission for several days. So what did the parents, what kind of excuse would the hospital have? To say that the parents were negligent.
To deviate a bit, you see me, if I'm sick, the way I've seen Nigerian hospitals, I'd rather die at home than go and kill myself in the hospital.
Why?
Because I look at Nigerian hospitals as death traps.
Wow.
That is the way I've witnessed too many deaths from negligence of Nigerian hospitals. So I can never believe that the parents were negligent. I can never believe.
Okay,
I think number one, the good thing is that you mentioned it. You cannot have an emergency case and you're saying that the devotion you must finish your devotion before attending to an emergency. It's amazing, sincerely. Then secondly, I think if I want to bring the parents into this, it took 2 days. I think it was the 3rd day that the pediatrician came in. Yeah. So as a parent, since they saw that the hospital were not willing to take responsibility and attend to their child, that was at the point they should have taken their child elsewhere.
In their defense, they wanted to take her away when she wasn't getting better. And the hospital said, no. We have specialists. We will take care of her. You can't, except you walk away from a hospital, you have to be discharged. Yeah. They didn't discharge her. They didn't allow them to take her away.
Second opinion. See, from I know that they said the hospital said they are blaming the parents, but from the first one, you're doing morning devotion. Second point, you misdiagnosed and it took 2-3 days before you could get back on meningitis. Third point, when you see no improvement, you didn't call for another pediatrician's opinion. You call for another doctor, and I'm wondering why we would have this happen when there is a medical board and the doctors are saying that it is the parents' fault. There's no basis.
Like, we'll come to you. Let's take our first phone call from Elder Fakponda from Egbeda. Good morning. Thank you for joining us, sir.
Yeah, good morning, Jumoke.
How are you today, sir?
I am fine.
Good.
Good morning, Dr. Another.
Good morning.
Jenny and the new person there.
Hey,
Good morning.
Yes, in the first place, I need to say prayer is good to start the day. But it's very wrong for an hospital not to have medical emergency.
Exactly.
Like we have in Lasso, there is medical emergency. If there is a critical issue like that, that baby should have been taken to the medical emergency, and the doctors should be made available there. That's number one. Then the gravity of what happened is a direct pointer to us about the level of our hospital decaying and the level of the standard of education in Nigeria. We seriously call for federal government to do something about it.
Okay.
If you look at, there was an article I read in The Punch about UCH. UCH in the early 80s, when we still have most of the template of late Obafemi Awolowo, UCH was rated as one among the best 100 in the world.
Imagine.
And the same UCH today, there is no facility. That is the truth of all.
You know, because listen, Tokwe, you say that you attend general hospitals and you see that sometimes they are unable to do more than they do anyways. The funding isn't there. They lack the right personnel. Now, I have friends that are medical doctors and they're saying Nigeria is just too hard. We're not taking care of what professionals. We see how our friends are taken care of abroad. I want to leave this country. And we're saying to them, how many healthcare workers do we have that some of you are thinking of running away already? So whose fault really is it? Can we blame people who are underpaid and are just there to earn a salary and they don't have passion for the job? Or is it really the government that is not standing on its toes and ensuring that the life of every Nigerian is taken seriously?
I think it's a 50-50 thing. It's a 50-50 thing. Why I say this is the same way I said schools should be monitored by the government. Private hospitals too should be monitored by the government. Because if they don't monitor them, I have nothing against prayer, but for goodness sake, when you have a patient, what are you praying for?
You're supposed to be on duty 24 hours of the day.
And, you know, and they do this a lot. You come into hospital, instead of treating you, they will be praying.
True.
God helps those who help themselves.
Punitive measures, until we have punitive measures, until we have punishments for wrongdoings like this. And we haven't seen any hospital shut down after so many people complaining of negligence leading to death. Until we see that, there won't be any improvement.
Are they going to shut down Luth?
So exactly, I mean, but then again, I think that the parents of Loli should take on the matter. We should support them and ensure if one person is punished, then others will take it seriously. We need to run off quickly. We have to take a break. Next, we discuss Nigeria being polio-free in the last 2 years. Please stay with us. We'll be right back. Welcome back. It's been 2 years since Nigeria had a new case of polio, which is a major stride towards Africa being declared free of the devastating disease. Poliomyelitis is an infectious disease that affects mainly children and causes paralysis of the limbs. According to the reports, Nigeria had more than half the world's cases in 2012, creating a lot of panic, which prompted swift response. Joining us on the show is the Rotary National Chairman, cardiology physician, Dr. Tunji Funsho. Welcome to the show, sir.
Thank you very much.
Fantastic to have you. To join the conversation, please call 0708066814 and tweet to us at TVC Connect with the hashtag YourViewTVC.
Are we taking tweets?
Yes,
first?
let's take a few tweets.
Okay. Akinyoyamen says, when you visit hospitals, they don't even attend to you, but keep referring you from one place to another. Effects Tony says, medical negligence is rampant. A lot of unprofessional doctors in hospitals putting money first before lives. Gabriel says, what is devotion when a patient is dying? Worship lies in what we do to our fellow men, not in contrite prayers.
David Demi says, no test conducted yet, them go assume or guess you have a particular sickness. Nigeria healthcare system is hell, God save us. Oluwatoyin says, especially in government hospitals, either you know a nurse or a doctor that will give you easy passage before you can even get tested. Oluwatoyin also said, I have discovered that in our hospitals, you have to know someone, like an insider, before you get attended to. Agunwi Ebi Michael says, Nigeria is just going from fry pan to fire every day. Negligence in every sector in Nigeria. God help us.
From Judy Kemas, who says, General Hospital Igando now charges 15K for antenatal care before a patient registers. I think it is wrong.
That should be free. Now, sir, in the midst of all the medical negligence that we see around us, today, Nigeria is celebrating 2 years polio-free. How did we get there?
I think, first of all, I have to say that we can achieve anything if we set our minds to it. Nigeria has confounded the critics who only 2 years ago thought we'll be the last country to eradicate polio.
Wow.
We have done it to the consternation of, even most of our partners, because the government decided it's time to get rid of polio and protect our children. I mean, we've come a long way. We started almost 30 years ago with 125 countries being infected, children being infected with polio virus, with 350,000 cases every year, to a situation where now we have only 2 countries, Afghanistan and Pakistan. And so far this year, we've had only 19 cases of polio. That's against 74 that we had last year.
Wow.
That is not to say that any child paralyzed by polio is not important. But the thing is that we can see a gradual decline to the point where the world itself will be without polio. I think we have cause to celebrate, as I said earlier, in Nigeria, but it is not Uhuru yet.
Uhuru. You're a Rotaract. Why is it the NGOs, the World Health Organization, celebrating it this day? I would have expected the federal government, the state governments to be the most excited,
I think the government is very excited. I mean, the president put out a message, to the country only on Sunday, reiterating our progress and also the commitment of the government to ensure that we continue for another year without polio, to ensure that Nigeria is polio free, including fund commitments, which is very gratifying.
Question: next year, it will be, if we don't have any case, it will be polio free. Does that mean that polio cannot come back here at all after that third year, or we can still fall back?
As long as there's a case of polio in any corner of the world, no matter how far, children everywhere in the world, not only Nigeria, are still prone to the disease, because the virus is only a plane ride away. So until the world is certified polio free, we have to continue immunizing our children.
So we need to be watching those 19 cases in those 2 countries, right?
We need to ensure that those 19 cases in those 2 countries don't occur again.
Okay. I was going to say that. I was going to ask because, that it was almost same case with Liberia where they were celebrating that, Ebola is gone, and at the end of the day, a few weeks later, it was back again. So my question is, what measures have you put in place to ensure that we're totally free, sort of?
I'll let you answer that question, but we need to take a break.
Okay.
Please stay with us. We'll be right back. Back. Okay, you are going to answer Favor's question, sir. Okay, Tokwe, go ahead with your question. Let's take all the questions at once.
She asked about how you're getting to the rural areas, and I wanted to ask about the fact that some people are politicizing the end of polio to mean that one administration was able to do this. I read online that it was accrued to the previous President Jonathan's administration. Please.
I think the first thing is that reaching rural areas. We continue to have what we call national immunization days and sub-national immunization days.
Okay.
So far, this year, you may be aware that in March and April, we had nationally health workers going from house to house, making sure that every child is reached. And we're still going to have one in October this year in states that we think are high-risk states in the north.
Okay.
So that continues to be the case.
Accruing it to one administration?
Well, basically, it's a struggle that we started 30 years ago.
Okay.
It's been a lot of efforts by various administrations, various governments, both local and international, partner agencies, as we've mentioned earlier, WHO, CDC, UNICEF, the Bill and Gates Foundation, with the continuous, catalyzation of the process by Rotary International.
Okay.
So we cannot say one government, is responsible. What we can, say proudly is that in the last 15 to 20 years, the government has gotten very involved in ensuring, that the program, goes forward as, against, previous to that time.
So are we sure that they're not going to relax and say, now we're polio free, so we don't need immunization? How do we ensure that Nigeria continues to be polio free?
I think by doing what we're doing here this morning,
okay,
by advocating to the public to make them aware that they need to continue immunizing their children,
okay,
by advocating with government. And I'm delighted that, the government of President Buhari only 2 days ago came out with a statement fully supporting not only by words, by deeds, but also providing finance to ensure that what needs to be done as far as immunization is concerned, not even just polio, every child is covered.
Okay.
You want me to take
a few tweets, just in case we have any questions for him to answer before we run off.
Edwin Tam says, thank God free polio, but there are other killer diseases in Nigeria. Government should give more support.
Okay.
Adekambi says, love your show. Why too many commercial breaks today? Lawrence Elias says, okay, I agree with Yenny. Our hospitals are a just death trap. Lost my 11-month-old baby due to their negligence.
Oh.
She died before giving attention.
Oh.
FX Tomlin says, polio is lack of awareness. A lot of people are uneducated. As a copper, explaining the importance of vaccine is a problem. Do you face that problem?
Yeah.
Because
yes,
you're saying
basically, you see what you don't see, is not dramatic.
Okay.
So you need to continue putting it in the face of people that this can happen. That is why we're using polio survivors. In a lot of our outreaches, we get polio survivors to accompany us. So they can use themselves as an example of what will happen if a child is not immunized. And that has helped us, tremendously. Now, polio, why polio? Because polio is an easily eradicatable disease.
So why should we not be?
So why should we not just eradicate it? And we are right at the end, of the effort. That is not to say that other aspects are being neglected. I know that this government is quite focused on primary health care. So they are strengthening primary health care facilities so that children in particular will get immunization not only for polio but also for other childhood preventable diseases.
Your last statement, it seems a little bit contrary to what we discussed in Hot Topic. The government is doing something, but the citizens aren't seeing what the government is doing. Where's the gap? How do we feel it?
Well, the gap basically is that when you're doing preventative health, it is not in your face. It's not something that you can see. For instance, when we're immunizing children against a disease, the child doesn't get the disease, so you don't see the impact.
Yes,
it's like every other aspect of preventive health care. When people stay healthy, it is not dramatic. You don't complain that I'm healthy.
Me, I'm really if I'm healthy.
You only complain when you're unhealthy.
So generally, people should we should keep on getting polio immunization, even if we don't see anybody having polio.
Yeah. Precisely, until the world is certified polio-free, and the relevant, health bodies, particularly WHO, now says, look, we can now stop immunization all over the world.
Thank you very much, Dr. YK. We've run out of time totally. Thank you so very much, Dr. Funsho, for coming this morning. And we hope that Nigerians keep on doing the right thing to, kick and make polio stay out of Nigeria. Thank you so very much for watching. We'll see you tomorrow morning. Thank you very much for staying with us. Bye-bye.
Thank you.